Just that's right. And the positivity level is up, but the actual number of cases is down from last week. And I spoke to Dr. Bratzler with OU Medicine today, and he told me he believes that's because of last week's ice storm causing some of the testing sites across the state to shut down. So he expects those numbers to start creeping back up over the next week or so as testing fully resumes. But what really worries him and some of the other medical professionals across the state is just the amount of people in the hospital with COVID.
OU's chief COVID officer, Dr. Dale Bratzler, today explaining why the state is seeing more people in hospitals with COVID-19.
There's been a couple of shifts that have happened. Although younger people are still the most likely to be confirmed as new cases, we've seen the number of older people who are getting infected going up again. And because of that, we're seeing our hospitalization numbers go way up.
Dr. Bratzler says as of Tuesday, there were more than 1,000 people in the hospital with COVID statewide, the highest number we've seen during the pandemic. He says the increase in hospitalizations still boils down to indoor gatherings with people congregating without masks and the lack of mask mandates in areas throughout the state.
It turns out we're seeing more new cases per day by population in many of the rural counties in Oklahoma than we are in the cities that have mask mandates in place.
He also tells me there are nearly 350 people in the ICU, which poses a huge problem with Oklahoma hospitals down to 8% of available ICU beds.
And we may see 70, 80, 90 deaths per week in our state just based on the sheer number of people that are sick enough to be in the hospital in the ICU.
Now, I want to stay on that ICU issue that he just brought up. Now, Dr. Bratzler also tells me when you talk about hospital capacity, you also have to consider the people in the ICU who have other diseases as well. That's why it's so important to bring those numbers down, because that space is really needed.